1. Making healthcare a human right. 1. Medicare for all makes healthcare a human right. According to the definition of UN, human rights are rights inherent to all human beings. Human rights include the right to live and liberty. Everyone is entitled to these rights without discrimination. Standards in 2017 says, in America, 28 million Americans are still uninsured and millions more are underinsured because of the high deductibles and premiums. Thousands die each year because they can't see a doctor in time, and millions more suffer unnecessarily because of delayed treatment. Unbelievably, nearly 1 out of 5 adult Americans are unable to afford the prescription drugs their doctors prescribe. George in 2018 says that the U.S. does not really have a healthcare system, only a health insurance system. U.S. must protect this right by ensuring that everyone within their jurisdiction has access to underlying determinants of health and through a comprehensive system of healthcare, which is available to everyone without discrimination and economically accessible to all. Yale University 2020 estimate that with Medicare for all, 68,511 lives will be saved annually. Contention 2, poverty. Many stay in poverty because of medical out-of-pocket expenses. According to Brunei in 2019, medical out-of-pocket expenses take up 22% of the income of poor people, where every $1 in $5 received by the nation goes towards out-of-pocket expenses. However, it is not nearly as much for the people above the poverty line. However, the Medicare for All plan of 2019 means that there will no longer be out-of-pocket expenses, meaning that people in poverty no longer have to spend over 20% of their income on these expenses, which is why Brunei continues in 19 that Medicare for All could decrease poverty by 22% and increase the income of those in poverty by 29%. The impact is huge, as the census quantifies in 19 that if we got rid of the out-of-pocket expenses, more than 8 million people will be lifted out of poverty. Contention 3, preventive care. Preventive care is the most important form of care, as according to the Barrow Group in July, preventive care is a type of healthcare whose purpose is to shift the focus of healthcare from treating sicknesses to maintaining wellness, and it cures before you feel sick or notice any symptoms, and is designed to prevent or delay the onset of illnesses and disease. However, sadly, the Agency of Healthcare Research and Quality wrote in 17 that only 8% of adults receive their recommended high-priority preventative services. The media warns that this is because the cost of preventive care is too expensive in the status quo. For the 28 million Americans that are currently uninsured, even the most basics of preventive care are too much. And even for those that are insured, most cannot afford co-payments involved in preventive care. Luckily, Medicare for All solves this problem, as in Section 201 of the 2019 plan, everyone will have access to preventive care without cost. There are 2 huge benefits to preventive care. The first is saving costs, as the Barrow Group writes in July, because preventive care lowers the cost of long-term management of diseases by solving it in the early stages where it is actually treatable. And there is a return of $5.6 for every $1 spent on preventive strategies in America. The second benefit is saving lives, as the Institute of Medicine emphasized in 2010 that preventive care can avert 17% of all chronic cases, saving 26% of all deaths in the U.S., which is 1.2 million people. Contention for helping the LGBTQ community. There are systematic barriers that discriminate against the most vulnerable groups in the current Medicare system. For example, according to Galena in 19, because of the discrimination LGBTQ teenagers face, they are 5 times more likely to commit suicide than their heterosexual peers. However, with the high cost of counseling and prescription drugs in their system, many LGBTQ individuals do not get the help they need.